here we are. Dr. Tamara Beckford with your Care and Docs, Telemedicine Urgent Care, and welcome back to our weekly topic. This has been now week 3 for us. So remember, we talked about you get the first dose. If you have the Pfizer vaccine, you get your first dose, and then 3 weeks later, you get your next dose. Boom, yes. Here I am. I have received the second dose. So we'll talk about how I'm feeling, right? But before we do all that, we need to talk about how COVID affects the lungs. And now a lot of people are hesitant about getting the COVID vaccine, because of many myriad amount of reasons. Some people are scared. Some people have seen things that said that it's going to mutate you. Some people have also been afraid because of the fact of this country's history in vaccinating those people who are minority, right? Because we've been tested upon in history within this country. So there's a myriad, varied reasons as to why some people are afraid to get this vaccine. However, I do want to let you guys know that this pandemic is real. And within the last few days, we've had another surge of COVID cases. The hospitals are full. In a few days, there'll probably be very few, if not any, beds available for patients who are severely ill with COVID. Now, I know we've all been talking about COVID affected lungs, and it does this and it does that, but I think a picture is worth 1,000 words. And so I today have decided to just show you how COVID affects the lungs, what it looks like for those of us who are treating patients in the ER or in the ICU, in the hospital, those of us who are treating patients who have COVID, and why we're so concerned, and why we give you the varied amount of clinical information and some warnings and cautions. This is what you look out for. This is when you come to the emergency room. This is when you can safely be treated at home, so that we can reduce the amount of patients that do not actually need to be in the ER at that point in time, right? So we're not chasing anyone away. We just want to give you the opportunity to understand that here, when you have this particular thing going on, you can safely be treated at home. However, if you're at this stage, you need to be in the emergency room, right? So with all that in mind, let's get started. I am going to put us in a presentation mode. So let me get us going. Give me a few seconds here. We're changing our screen to a presentation screen. And with this, now I also have to change this to presentation mode. So here we are, how COVID affects your lungs, right? So we talked about COVID. It is a virus, and it's a virus that is respiratory based. Now, does it only affect the lungs? No, but it does so for the majority of patients who are having a lot of distress. It's usually due to the COVID effects in the lungs. Now, in order for us to understand what's going on, it's best for us to start off with some anatomy, which I usually like to do. So we'll be good. Let's start sharing our screen. All right, here we go. Good. All right, so we're going to talk about the anatomy of the lungs. So I'm just going to continue what we're talking about, right? So we're breathing in our air here, in through the trachea, into the bronchioles. As I mentioned, we have the bronchioles here, and then it goes into the alveoli. So reason it going down into the alveoli, that's where the gas exchange occurs, where oxygen goes in through the alveoli into our system, right? So that's important for us to be able to breathe. That's how breathing really is occurring. Now, if we have a patient who has a normal chest x-ray, so this is us with a normal lungs. Now, the same bronchi here, you notice that it's all dark, right? It's dark for a reason, because the way how x-rays work. If you are going through air and there's nothing for the beams to bounce off, then it goes all the way through, and therefore it's dark, right? So this, although this is an quote unquote an overexposed, but it gives us all what we're talking about, right? So the lungs are here. The lungs are nice and clear. You're not seeing anything. This is this is the trachea that we saw before, and it's broke down onto both sides. And then we have our lungs on this side, lungs on the other side. This is our heart right here, right? This is our diaphragm that we're seeing there. So lungs are all here, nice and clear. Now, when someone has COVID, right, and you have mild COVID symptoms, you notice a difference between the lungs, right? The black part is up here, so that's the air, and then you're starting to see some changes and it's starting to look a little denser down there. So it's denser down in that area because there is an irritation that's occurring to the lungs, right? So the lungs are irritated, and this is because of the virus, which is now causing irritation slash inflammation to the lungs itself. So if someone has this going on in their lungs with the COVID, they're going to start having some mild respiratory discomfort, right? They'll have the mild respiratory distress. So for patients who have been diagnosed with COVID, and when we say, hey, ensure that you have your pulse ox so that you can check your oxygen levels, this is the reason why. Because we know that the virus affects the lungs, and you have your oxygen levels can become diminished and it can decrease as this virus is going through your body. Does this happen to everybody? No, but it does happen to some. You're checking your oxygen level is say 95, 96%. You feel crappy, but your oxygen level is good, right? We're pretty happy with that, especially since you have your pulse ox. Say your oxygen level starts to drop below 90%. You're at 89, you're at 88%. That's when we're saying you need to go to the emergency room. Now, say this person continues to have their COVID symptoms and it starts to get worse. So now this is how bad, this is not the worst, but this is how bad someone with COVID, that you can start to see the fact that the black area that we had on the first slide, you barely see it. So now this person, their lungs is inflamed, is irritated, they have what we call the severe COVID infection. Now, if someone has this, they're in a lot of respiratory distress. So their oxygen level is not going to be 95, 96. This person is barely breathing. They're breathing very fast. They're gasping for air. This person is at home and needs to get to the ER emergently, right? Because if you can barely see the black portion, then where is the oxygen exchange occurring? The lungs are filled at this point in time. This person is in a lot of distress. And as a matter of fact, this person is so sick, there's a great chance that this person is going to have to be intubated and be placed on a ventilator. So this is how COVID can really go and wreak havoc on your lungs. So when we're seeing all of this in the ER, in the ICUs, yes, we're doing all we can to treat it. But the biggest thing that we want to do right now for those who have not been infected with COVID, or for those who were infected, had a mild case, because you can get COVID again, our biggest goal right now is prevention, right? Prevention, prevention, prevention. So we're trying to prevent those who have not gotten COVID, those who are immunocompromised, those who are older, those who have a lot of comorbidities from developing COVID and being this patient. I'll tell you this. In addition to working and being the CEO of Your Caring Docs Telemedicine Urgent Care, I'm a board certified ER physician. I've been working in the ER now for over 10 years. I am on the front line. Earlier this week, yes, for 3 days straight, working in the ER, and the surge is real. There are tons and tons of patients. Patients are in the hallway now. The hospitals are bursting at the seams. Some patients have the mild version, which we showed you, and then some patients are coming in with these severe COVID symptoms. It is not easy seeing patients this sick, especially if you are seeing them consistently every single day. It really does take a toll on the healthcare workers. Our goal when we went into medicine, when we went into healthcare, is to help and to prevent and to heal. But we need you guys as the public, we need your help. Please get yourself vaccinated. You know, we want to have our social gatherings. We do. I mean, human beings are social beings. We want to gather. Now, we can safely gather in 2021 if the majority of us are vaccinated, and we can help to prevent the spread of this virus, because now we do know that there is a more of a strain that spreads a lot faster that's out there, right? Before they were calling it the UK version, but now it's here in the US. Now, is it more virulent? It's stated that it's not more virulent than the current COVID virus, but it spreads faster. So if it's spreading faster and we're having people are gathering, so we are going to expect that we're going to have more patients that whose lungs are going to look like this. If the resources are starting to become limited, then people are going to die. Unfortunately, more people are going to die, which this is not what we want, right? Few days ago, I had 98-year-old patients coming in, starting to have respiratory distress. How did this 98-year-old patient get this COVID vaccine? Family gathering at Christmas. So now you can think about Christmas. Someone came to the house. Afterwards, they found out they're COVID positive. Few days later, now grandma's in respiratory distress. Grandma's 98. What is the likelihood that poor grandma will make it through? This is what is happening out there. So I felt that as an ER physician, as a person on the front line, as someone who is here and seeing this, that it's important for you to see what's going on. We talk about it and we said, yeah, people are in distress, but it's a difference between seeing what the lungs look like when you have normal lungs versus when you have a mild form and you're coughing, you're feeling short of breath, and then you have a lungs where you're just going to probably have to be intubated and be on a ventilator, and we're praying that you make it off. That's not what we want, people. We really do not want that, right? We really want to be able to gather. If we think about it, the next big gathering day coming up in March, we have St. Patty's Day. People want to be able to enjoy that, right? And then Easter's coming up, April 4th, Easter. Wouldn't it be great if we can celebrate with our family on Easter and not have to worry about bringing this virus to poor grandma? Wouldn't that be lovely? Please, please, please go and get yourselves vaccinated. It's very important, and we want to do that so that we can safely gather and we can enjoy our time with our family. Now, as we stated as a bonus, I myself, I got vaccinated, right? So this is me getting the vaccine, and this is 36 hours ago. Now, I know that there are some people who, after getting their second dose of their vaccine, I am getting the Pfizer vaccine. Some people have had some side effects, such as they'll get like headache, or they might get some body ache. Some people have gotten chills. Some people have had fatigue, like extreme fatigue. I am happy to say I didn't have any of those. Soreness to the arm, yes, like I said the first time, if I do this, yeah, it hurts. If I'm do this, it doesn't hurt. Other than that, the fatigue I had was nothing different than the fatigue of working 3 days in a row in the ER on the front line in a pandemic and being a mother of 2 toddler boys. Right? So as I explained today, I went over what the lungs look like when you have a normal lungs, that with mild COVID and that with severe COVID. I hope that these pictures, that with what you're seeing, it helps to for you to understand why we're asking those of you who have not been vaccinated to get vaccinated, to help us get out of this pandemic. We want to be able to celebrate. We do want to be able to celebrate, right? I look forward to seeing you guys next week. We're going to go over another topic. I hope you enjoyed and understood what went on today. Please leave a comment. Let me know what you thought. Let me know what you learned. Please share with others and subscribe to this particular channel. And I will see you guys next week, right? I do want to give a caveat. If you are having mild COVID symptoms, if you're Texas or New Jersey, your Caring Dogs Telemedicine Urgent Care can take care of you. Just go online to our www.urcaringdocs.com and book an appointment, right? Dr. Beckford here, and I look forward to taking excellent care of you and your family. Take care and bye-bye. Get us out of here.